Hi and good morning everyone. This is Dr. Hari from Cell Tissue Technology, and today I'm actually here to speak a little bit about the role of tissue engineered products, basically human skin, and how it can help with the healing of chronic wounds. So, like I previously mentioned before, chronic wounds have been affecting the lives of many patients for as long as I can remember. So, while there's been a lot of progress and a lot of improvement in management in treating chronic wounds, we still notice that there are a lot of patients who are still missed out by the system, unable to be treated due to limitations such as financial limitations, just overcrowding of patients, and lack of doctors, healthcare givers to actually help these patients. So in situations like this, I feel that tissue engineered products can actually help. Using tissue engineered human skin, for example, we can get human skin from either donor, if you're comfortable, or even your own skin to produce skin to cover your wounds to prevent infection. See, lots of chronic wounds tend to not heal because number one, patients do not have enough time or limitation due to finances to get the right number of dressing, the right number of wound care, the right number of wound debridements. So, and when you add missing appointments due to limitations, what we have is a big group of patients with chronic wounds that don't heal. So when you have situations like this, using our tissue engineered products, we can actually bypass all these issues that patients are currently facing. For example, whenever you have a chronic wound, the wound area usually forgets to heal. So what we want to do is usually remind areas of the wound that healing is still necessary. So once we have situations like this, we have a particular tissue engineered product that is actually manufactured from the soup that is produced by stem cells. So you get a group of stem cells, you culture them, and the soup that is produced by these cells, which are basically growth factors, can be applied on the chronic wound and improve the area around it in a way that reminds the area to continue healing, to not forget that healing is still necessary there. So once we have increased healing by the cells themselves in that area, we can start proceeding with actually focusing on the wound to heal. So once we've gotten the cells to rapidly divide in the area that has already forgotten to heal, we can now put skin over the area that is exposed to prevent infection. So what we have is we have two types. Some patients require skin immediately. So in situations like that, we always have donor skin that is pre-made, donated from young patients, and these cells are actively dividing cells that can help with wound healing. And if the patient can afford to wait for a week, we can actually get the skin from the patient, culture it in the lab, and turn it into skin that can be used as a permanent coverage for the patient's own skin. So the patient no longer has to worry about, what do we do once we remove the dressing? How long will it take for my skin to completely close up? So if you have an option to use your own skin to cover a pre-existing exposed area, I feel that would be a very good solution for a lot of patients. So in view of this, we are trying to find a way to shorten the period of trauma that the patient experiences, reduce their overall cost when it comes to healing the wound, and also reduce their time being admitted in centers, which can also directly reduce their chances of getting infection over the wound. With that in mind, I would like to invite all our audience to come and see us at the end of this month at Flexis, like we've mentioned before. If you've been following up with us, we are going to give a health talk about how chronic wounds have been affecting people for so long, what we can do, and how we can help. It is important to remember that at the moment, current standard practice, the pre-existing management methods that we have now are good. We need them, but what we have realized is it is not enough. So this is where we come in to help out patients and both healthcare professionals to at least reduce or stop the progression of the number of chronic wounds in Malaysia. With that in mind, I'd like to thank Advanced Wound Care by Celllora and also Cell Tissue Biobank for bringing us this information. Thank you very much and hope to see you guys soon.